Welcome back to Human. I am so excited because today is actually a guest episode. I know we haven't done a guest episode in a hot minute. I actually made a poll on my Instagram account at Human Pod saying like how long has it been since I've done a guest episode, and most people genuinely thought it was a year. It has been a year since I've been consistently doing guest episodes. This show, when it first began, was just all guest after guest after guest, and I was so scared of doing solo episodes, and now I'm like all about the solos, and I love a good guest episode. But when I'm doing a guest episode, now I'm like, oh, I miss talking just me and listening to myself. So I also took a month off because I just moved into a downtown Toronto apartment. So it's been a moment since I've been recording, and it feels good to be here. And yeah. So today I am with the founder of Reya Health, which I kind of dive into what Rhea actually is in the episode, but Dallas is a birth control specialist, I would like to say. And the main parts of our conversation revolved around debunking common misconceptions about birth control and the side effects of them, and kind of what to expect with birth control and how it's different for every person. We talked about the different stereotypes, stigmas, and the lack of education that we really have about birth control and our health and our bodies. And I've been having so many conversations about this recently, so it feels so good to have someone come on who has so much more knowledge than I do to discuss it. A few other things we talk about is how to actually discuss with your sexual partner, whether you're in a relationship or not, about your body, your boundaries, and your birth control, and kind of getting on the same page and being able to hold the responsibility for that. So I'm going to let you listen to this, but before I do that, I want to talk about the importance. It sounded like I was about to go to a sponsorship. Guys, we're not there. Before we dive into our episode, let me tell you who our sponsor is. No, we do this out of my own pocket, but it is the dream to do this for a living. But anyway, I would love for this to be maybe a little welcome to discussing your own sexual health, becoming more attuned with how your body is feeling and doing and where it's at, because this is so coincidental or not coincidental for me to edit this episode today, because I got a pap smear today for the first time. I actually thought I got a pap smear when I had my yeast infection problem to the point where I went to the hospital, which is so common actually. Dallas talks in this episode about how she went to the hospital because her birth control side effects were so terrible. Anyway, I thought I got a pap smear when I went to the hospital then. I didn't. I just got a pap smear today for the first time in Ontario. If you didn't know, when you're 21 and sexually active, that is the time to get the smear. And they're basically, I'm realizing how uneducated I am right now even trying to tell you what a pap smear is for. They check my ovaries. They swab. Oh, I know, I'm sorry. I won't get into detail. Ugh. They swab up in there. They're checking you for cervical cancer, I'm pretty sure. But let this be a little reminder that it can be empowering to take control of your health. It can be challenging, especially for those who have experienced traumas, and your body will react to those. So, talk to the people you trust about what's best for your body, but I think it's really important to get our health checked out. So use this episode as a little inspo. I hope you learned something about birth control or just feel validated in your own personal experience, because I know 16-year-old Jess was like, yes, I didn't know so many things, and I still don't know so many things, and it is okay not to know so many things. But without further ado, I will let Dallas and past me do the rest of the talking. I am with the founder of Reya Health, and Rhea provides support and personalized information and helps people find the right birth control method for them and make sure that they feel really comfortable and confident in their unique journey, because our birth control journeys are so specific to who we are, and it's so important to talk to our sexual partners about it. And so we are going to dive into all things birth control. And what I really want to start with is the accessibility and education issues. And you've talked about this, Dallas, and I want to hear about how you experienced a real lack of medical support and really feeling validated in your birth control journey.
Of course. Yeah, let's dive right in. So I started using birth control back when I was in my late teens. And we're not taught birth control in school. Like, these conversations are barely happening within our friend circles and in our households. So going to my family doctor, I knew there was a condom and a pill.
Mhm.
And so when my family physician handed me a pack of pills, like, I, no questions asked, started using it, and very quickly started to develop symptoms and side effects that I was not prepared for. I didn't know how to cope with them, what to do, if it was normal, what questions to ask. And so I went to book another doctor's appointment, which was, again, several weeks out. And so in that time frame, I honestly forget what I did at that point, but remembering turning to the internet to ask all of my questions and receiving information that was really overwhelming. I'm sure we have all been there trying to Google something health related, and it just coming back feeling worse than when you began. And so this started my long trial and error journey of trying to find an option that I liked and that was compatible with my body. One method in particular that I used, my body just reacted so adversely to it. I started to develop ovarian cysts, UTIs. I was cramping, in constant pain, bleeding nonstop. I actually had an arrangement with my university professors and doctor to excuse me from classes because sometimes the pain was just so unbearable that I couldn't get out of bed. Like, that was insane. And so I really wanted this option to work so badly, but I also was extremely uncomfortable with all of those things that I just mentioned. So when going to speak with medical professionals and ask for help, oftentimes I was dismissed and told, no, that has nothing to do with your birth control. No, your body's just changing, all of these things, or even, no, your body's just adjusting to the new birth control option, which is totally fair. There is an adjustment period when you try a new birth control option, hormonal and non-hormonal, where your body is getting used to this new method, this new medication, these new habits. And of course, as with any medication, you might go through some changes, and generally those may start to subside. However, for me, in this particularly fun story, I was about over 5 months in, well beyond the adjustment period, and my symptoms were not getting any better. The last straw actually was when I was admitted to the hospital due to one of the cysts on my ovaries. And I was lying there thinking to myself, this is insane. This is so stupid. Here I am trying to be proactive about my health, and it's kicking me in the butt, so that actually was a pretty big wake-up call for me. I was the night I had a hormonal IUD that was causing all of these issues. I had it removed, and my body just took a breath of fresh air. And little did I know, from the get-go, my body was screaming at me, being no way, girl, this is not it. This is not the one for us. And was sending me all of these signs that this was not a good fit. This was not the right option that I should be using. And I just ignored it. I, pushed those little voices to the side. And that was a very isolating experience in itself, especially to feel invalidated by healthcare professionals. And, I don't think it's necessarily their fault. I think overall, within women's health and reproductive health, we just lack information. We lack resources. There's a lack of funding and effort allocated to getting the information that we need. So when we do go to a medical professional with side effects that are totally valid, our experience is for sure valid, they can't reflect back with a statistic or evidence-based research to validate how we're feeling. And that's frustrating. Mm-hmm. Not to say that what you're feeling is not because of your birth control. It's just to say that there's no, statistical significance, which is stupid. Like we know now, I hope everybody knows now that, we're all so unique and different that of course we're all going to respond to things differently. So for me, the IUD didn't really work, but Jessica, maybe for you, it would be like the perfect option. Yeah, we're figuring it out. I feel like that was a very long-winded answer to the question.
No,
as you can see, I'm very passionate about this.
Yes, for sure. And I think that the reactions by some medical professionals like that and just the overall lack of education makes you not know where to even begin asking a question. You don't know where to start and what to say. And I think it's so common that we just share horror stories too as women, because I've had friends go through a similar thing. And so we just listen to what other people have experienced. And so we're terrified of one option, or we think one option will be perfect for us, and we try and force ourselves into it. And that can cause so much pain to the point where you were in the hospital.
I am so glad you brought this up, because this is a conversation we have a lot at Rhea. And something, you call it a myth, misconception, I'm not sure, but something that we're really trying to like change the narrative on. So I believe that sharing stories and telling your story with friends, family, whoever is super important. Story sharing is healing, it can be a part of therapy, not only for you to, get that off your shoulders and explain your experience to other people, but also for others to see their story reflected in your own and resonate with somebody. It creates community. I think that's a really beautiful thing. However, it becomes harmful when people start projecting their negative experience onto others and, basically fear mongering that this was my experience with the IUD, for example. And so don't try it. Like, it's horrible. Like, I went all through these things. Like, it's not worth it. Don't do it. And that's just so unfair, in a place where we're already scrounging for more birth control options, hormonal and non-hormonal, that for somebody to like scare somebody out of trying an option or even just learning about a new option is like sad to me. I think, sharing those stories, sharing those negative experiences is okay. And it helps for people to create kind of like a mental database, but it's all about taking that information kind of with like a pinch of salt, if you will, and having more of an internal dialogue with yourself and using tools to help you navigate that process on a personalized and individualistic level.
Yeah, I completely agree. I think it's important to keep perspective and to remember that one person's body is so different than your own. And that's what I love about your platform, is that you can go through a quiz and find what is more personalized for you and what is a better option for your own body.
Mm-hmm. Yeah. And I mean, at the end of the day, we really just want to meet people where they're at. We're all coming at these issues and trying to find solutions from different backgrounds, different lived experiences, different preferences and lifestyles. And our approach to find these options and the options that we choose should reflect that. I think our bodies are incredibly unique and incredibly complex, and that complexity is beautiful. And if we pay attention to that at the forefront of this contraceptive counseling process, then we can find an ideal match and feel confident in that.
I agree. And I also want to kind of jump into the different stigmas and stereotypes that are experienced when talking about going on birth control, when sharing stories. And I remember when I was 16 and I was the same as you, I only knew of pills and condoms. And so I was like, well, when I want to have sex, I'm going to go on a pill, without knowing the effects it could have on my body and how different they could be for everybody. But I just remember the stereotype of, if you go on the pill, you're going to gain weight. And that's what like girls told me when I was like 16 years old. And I think it can make the journey of trying to find something that works for you and feels empowering for you very difficult.
Oh, for sure. Yeah, there's so many different voices and narratives that surround birth control and surround people with ovaries taking matters into their own hands and, living fully in their health journey and in their life. I think stigmas that come up, especially as a young person trying to navigate birth control. First, birth control is used for many different reasons other than just birth control. So oftentimes, people go on a pill or IUD or whatever it might be for reasons, and they might not even be sexually active.
Mm-hmm.
That was the case for a number of my friends in high school, and they wanted to keep it private. Like they were really, I felt ashamed almost by having birth control because they didn't want to be called a slut or have people think that they were sexually active when, oh, maybe she didn't have a boyfriend, or all of these ridiculous scenarios that, that could be a whole podcast episode in itself. But birth control can be used for other things. It's not a cure for endometrial conditions like PCOS and endometriosis, but it can be really helpful for somebody trying to manage those symptoms. Getting, surgery or treatment for endometriosis, or even a diagnosis for these things, takes years sometimes. And meanwhile, people are really struggling. So sometimes birth control can help increase somebody's quality of life. And I think that's okay. If we're going into other, myths or stigmas, it's frustrating when the importance of birth control is placed on the shoulders of the person who, quote unquote, bears the ultimate risk. That being the person with the uterus, with the ovaries. I think more male contraceptive options that are reversible need to be quicker to market, and
Yeah.
to be more innovation here. And, I think that until that happens, there's a lot of things that couples or people in your relationship, or just, people with penises can do to take more ownership and responsibility and really support the other person in this journey.
Yeah, I was reading in a blog post that you wrote about this, and I 100% wanted to talk about it. Is you actually should suggest, splitting the responsibility, whatever that looks like for someone with a sexual partner, and whether that is splitting the cost of a birth control, or like, both, splitting the cost of condoms, or helping remind, like one person reminds the other to take their pill. And I'd love to hear you kind of talk about advice and just suggestions on how to get that conversation going and to set those boundaries with your own body in a partner, even if you're not in a relationship, just with a sexual partner.
Yeah. And so we actually conducted some research with people with uteruses and with penises about how they have these conversations, and really even if they're having these conversations, and across multiple contexts. So your one night stands, your just casual hookup, your like long-term relationship, or just starting in a new relationship. And it was, very interesting. Across the board, it was generally assumed and like understood from the people that we asked that ultimately it was the person with the ovaries decision. It's whatever they wanted, and they should feel supported in that choice. And I think that's wonderful. Of course, I also think, and I had some interesting conversations with other people and people with penises who were like, yes, it is the person's with ovaries choice ultimately, but it's also something that I want to be aware of my own personal risk, going into this situation. And one individual I was chatting with, he was saying that he had brought this question up to some people before, like, before hooking up with somebody after the bar and being like, oh, are you on birth control? And they taking it very defensively and reacting in a way that was like, oh my gosh, why would you ask me that? And, I understand where that person is coming from and how maybe they may have felt, taken aback by that question. But I also think that it's a question we should be having more often, and it should be normalized, because the other individual who I asked and who had asked that question was just trying to be safe and like mindful of his future and of the dynamic, and like, you know, totally open to using a barrier method, internal or an external condom, and that'd be totally fine. But it was just a conversation that he was like, you know, I'm also not trying to have an unwanted pregnancy, and I want to understand my risk in this scenario. And I think that is totally valid. And I think that opening that question can be done in a way that is more seamless. And as you said, Jessica, it is kind of awkward. Like us learning in more recent years, which is so positive and empowering, but learning how to have a conversation about consent and even have a conversation about STIs, which I think even that actually, the STI conversation still needs a little bit of help and work.
Yes.
And so I think this birth control conversation plays into that. And I think it plays into it not only in opposite sex relationships, but same-sex relationships as well. You know, people in the queer community use birth control for a whole host of reasons, just as the cisgender community does. So I think that opening this conversation and really in a way that feels safe for the other person and makes them and is in a space where they feel open to chatting about it. You know, ideally, like all of these conversations happen before, you know, you're starting to get down and dirty. But then I think that opens a can of worms of like, okay, you know, you don't want to come on too strong or be presumptuous or like, you know, freak the person out. And those are totally valid points and, you know, valid questions. But I think we're all like, you know, consenting adults here, like use your wits about you and time it properly, even if it's like as easy as like asking beforehand, you know, as you know, you're in foreplay or whatever it is, like when the time comes, where do you want me to come?
Yeah, you know? Totally.
And like for me personally, and maybe this is TMI, I don't know, but I love that. I think it is so hot, so sexy when you're like in the moment and like the partner is asking me where I want them to come. I'm like, yes, I'm in control. This is so great.
I have an option. I can advocate for what I want and have it not be like a weird situation too. It's
And like they care and they like want to, you know, support that power. And I think that's so easy to do. That's a very easily implemented conversation to have, and kind of a way to like get around like, oh, what birth control are you on?
Yeah.
You know, more or less, or at least, you know, it opens that conversation. And so I think, you know, I don't have all of the answers, and there's a lot of different contexts where this, you know, does need to come up. But even just like starting to be comfortable asking it more, or even just checking in with your partner. If you do know your partner is on birth control or thinking about it, asking them what's important to them in a birth control option, or like, how does that birth control make them feel? You know, how does it work? Maybe, you know, the individual just really doesn't understand. You know, you and I just said we only knew about the pill and the condoms, and surely if we were not getting that information in school, like the boys' gym class probably was nowhere near that subject either.
Well, and it's funny because I think we have to be open to that now as adults too, and being open to saying, I don't know, or ask a question. And I'm getting so many flashbacks of experiences where I, starting in kind of my 20s now, I was like, you know what? I would remember having shower thoughts. Cause I think like when you're having a shower, you're getting ready to go on a date or to go out, you can kind of, you know, assume or think there is a chance something might go down today. Like, you know, we're not completely oblivious to these things. We are humans who have some sexual desires. And so I think we can really think to ourselves, okay, well, if I were to do that today, how would I feel comfortable? What would I feel good about? And my friend and I, we used to say too, I think we started, maybe once or twice, but I had a flashback of this, that we would be like, you know what? You should ask about the birth control or the STIs. When have you been tested? That kind of stuff before the pants come off. Before you're like, it gets much more heated, while you can have a bit more of a conversation about it and then feel good to, okay, we can proceed now. We know I feel good. My boundaries are being respected. And having that conversation internally with yourself or with a friend or someone you're comfortable with beforehand, I think is so much better too. Because I remember feeling so nervous in a situation, but wanting to make sure that I was being safe and I was feeling comfortable. So I also named it. And I was like, this is a really awkward question. But like when things started to progress and we were kissing, I was like, when's the last time you've been tested? Or like, do you have a condom on you? And that can help preparing yourself beforehand.
For sure. And just like calling out how you feel and be like, I don't really know how to approach this question. So like, I'm just going to ask.
Yeah.
and ask it. And I think that's totally okay. So for sure, I think that definitely helps. But that's so funny. Like I totally have been there, like getting ready to go out and be like, okay, this is how I'm going to ask them to use the condom. And like, sometimes you have to mentally prepare. And the same thing goes for like any health situation, going to chat with your doctor. Like you want to be prepared going into these conversations so that you feel validated, you feel like you have done your best to get the best care possible. And, in a sense, have the most fun and feel the most safe.
Yeah. And I think there's a way that we can go about birth control and our health and our reproductive health in a way that feels empowering. I think so many situations, the conversations, the stories, they can just feel so tiring or so shameful or just, scary even. But I think becoming more mature is having conversations about it and talking to yourself about it, journaling about it alone, kind of thinking about what feels best for you. And I think also when you're in a relationship talking about birth control, I had a question come in when I posted before we talked. Someone said like, I have some more questions we'll dive into, but someone actually said like, how do I approach the conversation with my boyfriend about wanting to go off my birth control method that I'm using right now? And I think it's important to remember that it is a decision. It is your body and your decision. And if your significant other really cares about you and your priorities of not getting pregnant or whatever your goals are, they should, support you and be like, okay, let's figure out a solution together. And knowing that they have your back is, I think, the most important thing. And if they don't, is this a relationship like that you want to be in?
Totally, for sure. That's exactly it. And I think even framing it in a conversation that allows them to weigh in, to being like, I've been mulling this over. This is what I've been thinking. These are the reasons why I've been thinking that this decision could be good, but I value your opinion. This is benefiting both of us. So like, what do you think about that? How does that make you feel? And hopefully they can, come at it in a supportive and an open-minded way and really have a conversation where you're both listening and hearing one another. And going from there and ultimately carving out a plan, saying like, okay, how can we go forward where we're both feeling comfortable, we're both feeling confident and both getting, what we want and what we need. But again, as you said, ultimately at the end of the day, like if, it's ultimately the person's with the ovaries decision and they have autonomy over their body. And I think there's always a solution where both people can feel confident and comfortable in the family planning methods.
Yeah. And I think it's important to sit with yourself too. I picture myself in bed, getting ready for bed, but not tired yet, scrolling on the internet. And instead of scrolling on the internet for advice, you can scroll on Rhea and see what is out there and what information you have in the blog post. I love the blog post you have. It is so validating to learn about other people's experiences sometimes, and to also learn the science behind this. And, knowing that some of your symptoms are because of your birth control. I think we can get in our head, like all circling back to the beginning about your story about your IUD. It's oftentimes, I think medical professionals cannot relate it to the IUD inside your body or the pills you're putting in your mouth or the NuvaRing inside of you. And I think going to a reliable health source is so important for getting the proper education.
Totally. And a health source that feels approachable.
Hmm.
There's lots of scholarly journals out there, and like you can go and look up some clinical trials, but like who the fuck wants to read that?
I have to do it for school and I don't want to. I have to like translate it to the words I think in.
Totally. And these conversations, these questions that we're asking are pretty intimate. They're things that are so deeply personal that I just can't see, the tie between like asking that question, wanting answers, and trying to find those answers in a place of, those articles and those journals. I did that for my own journey because I couldn't find information elsewhere. And that's really what started my process of taking matters into my own hands and, trying to find a birth control option that worked for me. But like, I wouldn't wish scouring scholarly journals for anybody.
No,
So
no.
finding reliable health sources, and I'm working so hard to create Rhea to be that. And I do think Rhea is that. We've worked with a number of medical professionals consisting of OBGYNs, naturopaths, family doctors to create not only the content on our website, but the methodology and the process that we take to match people to the best birth control option for them and help them monitor and track any changes that they might experience with trying a new option.
I love that Ray is approachable that way and has so much reliable resources that are easy to read and digest. And like you said, the scholarly journals are not where it's at. And I think it's important to note too that like we don't know what we don't know. So until you find yourself scrolling and trying to do more research, you can learn so much that you didn't know before and know that it's okay. And we don't need to feel shame or stupid because we don't have a slew of knowledge. Like you said too, we weren't taught this in school.
Totally. Yeah,
Yeah.
exactly.
So I have two specific questions that were submitted in, and I know we can find this on the platform as well, but I wanted to see if you can kind of touch on briefly a few non-hormonal birth control options.
Of course. Yeah. So number one, barrier methods. So these are things like your external/male condom, the internal/female condom, things that, prevent the sperm from reaching the egg. Those are non-hormonal. They are made out of silicone or polyurethane material, or sorry, not silicone, latex. um, and as well as the copper IUD. So this is one of the best options for long-lasting non-hormonal birth control. So it's an IUD, similar, a device that goes into your uterus, similar to the Mirena, which is very popular, the Kylena. And it stays in for about 7 to 10 years. And it's one of the most effective birth control methods out there. And it's actually the copper material that itself, the device itself is made out of, that prevents pregnancy.
Okay.
Fun fact about this option is it can actually be used as an emergency contraceptive. So instead of get the Plan B pill, you can get a copper IUD inserted, and then you don't have to worry about it thereafter for many years.
How soon after do you need to get the IUD put in though?
Ideally within 5 days. So
is
the kicker. That is the kicker of, trying to get that appointment. I think there's better chances if you go to, say, a women's health clinic that, is specialized in reproductive health services, or a sexual health clinic in your area, and tell them that you would like a copper IUD for emergency contraception, and they should be able to prioritize that and get you in there. I think that is a really great option, especially if you find yourself, having to take Plan B or Ella1, the emergency contraceptive pill, often or frequently. The copper IUD is a great non-hormonal, long-lasting alternative to that. There's also fertility awareness method as another non-hormonal birth control option. And this one has been gaining a lot of popularity lately, especially within the media. Rightly so. I think it is a wonderful tool that people with ovaries can have in their pocket to understand their body and develop a more intimate relationship with it. And as I mentioned earlier, this type of method has countless like other health benefits that I'm personally really excited about. The kicker with this one is that it requires a lot of habit building. So you have to diligently take your basal body temperature every morning. You have to learn and understand your cervical mucus, as well as even, taking ovulation at-home tests. And all of these things work in conjunction with, of course, tracking your cycle and tracking different symptoms, but they work to help you understand and pinpoint when you ovulate so that you know your fertile window throughout your menstrual cycle. And then you either don't have sex during that window or you use extra protection like condoms to prevent pregnancy. Outside of that window, it's significantly less chances of you getting pregnant. One app, so this is generally done in the form of an app if you want that good, consistent support when doing it. Natural Cycles is one that was the first FDA approved fertility awareness method for birth control. And I think on perfect use, they're saying that it's like 97% effective or a similar,
Wow.
a similar efficacy to condoms, which is, monumental for the non-hormonal birth control space. Unfortunately, doing all of those things that I just described can be inaccessible for some people, and it's just a lot. It's actually an option that I'm using right now, and I've been trying to, it's hit or miss for me with taking my temperature every day. So, I'm learning, and it's a process. So being diligent there. And of course, not having sex is another non-hormonal option, but I don't think that's a conversation we're here to have.
Oh my gosh. Well, that's great. I'm so glad we covered such a wide range of different non-hormonal birth control methods, because I think sometimes we only know a few and that's it. And these are all important things to talk to your medical professional about, like we discussed earlier too, coming into an appointment with numerous questions and your own knowledge about your history and what feels best for your own body.
For sure. Our system, unfortunately, at this stage, we're still an early stage company, so we don't have the capacity to provide virtual doctor consultations or do prescription deliveries. But what we do provide is a plan to help individuals navigate that conversation with their medical professional and how to have a focused conversation about options either that they were matched with on Rhea or want to learn more about. As you said, these conversations can be a little bit intimidating. And, there's so many things we want to know, but we might not know where to start. We might not know which questions we want to ask. So having a resource and a tool that says, okay, if you're interested in this option, this is how you would approach it. These are maybe a series of questions you might want to be asking, depending on what their preferences are, what their concerns are that came up in our profile in our system. We can support those individuals through that access process.
Mm-hmm. Absolutely. That's amazing. I'm so glad you have that feature on Rhea. That's great. So the last question that was submitted the most is, what are some of the long-term harmful effects of hormonal birth control?
That's so interesting that was the most asked question.
Yeah.
Oh my gosh. Okay. So from the information and the research that we have to date, there's no long-term side effects or, implications of using hormonal birth control. Oftentimes people are really concerned about their fertility after using hormonal birth control. I think that's fair and that's valid, because just the same as when you're starting on a birth control, hormonal and non-hormonal, when you're going off of a birth control method, your body is adjusting, it's trying to figure out its cycle again, going back into its natural rhythms. So you might even experience certain side effects after you transition off of a birth control method. During this time, your ovulation and your cycle might not be consistent. So some people could get pregnant right away after, removing their IUD or going off the pill. Other people, it could take months or even a couple of years until their cycle is regular and consistent enough where they are ovulating and able to get pregnant. And that, unfortunately, we're still learning things, but that does happen. However, there's no research or information to suggest that there's that long-term infertility effect.
Mm-hmm. That's interesting because I wonder that so much myself too. And I think it's so important. And I love that you state the research to date hasn't stated anything. And so I hope it can be a bit of a mind ease. I think we all have our own like little suspicions. But I think it's a great point that like there is a big transition when you're getting off of it, especially if you've been on, I don't know if it's especially, but I would assume, especially if you've been on a certain birth control for a very long time.
Yeah, and it does depend on the type, and everybody's body is different. Like I've talked to people who have been on the same pill for 10 years and they go off it, and within 2 months they're pregnant.
Mm-hmm.
Or I've heard the flip where someone has been on the pill for just a year and then they really struggle to get pregnant. Again, it is case by case. There's also the issue of trying to get pregnant after going off the pill, but not knowing that maybe you had cycle inconsistencies before going on a hormonal birth control.
Mm-hmm.
Maybe these were other underlying conditions beforehand, and they might not have anything to do with the hormonal birth control that you're using. Luckily, there are resources and tools, and healthcare has moved in a direction where there's a lot of support with infertility right now. So even just understanding what your body needs at different phases throughout your menstrual cycle can be monumental in creating a space for a more regular period, a more regular cycle, and understanding when you're ovulating and what your body needs to perform and thrive.
Yes. Oh my gosh. Thank you so much. This has been so full of information, and I hope people turn to Rhea to further expand their knowledge. I know I absolutely loved taking the quiz. I actually got the results of the birth control I've been on for a while now. So I was like, awesome. Yeah.
So validating. So, sometimes people go through our system just because they're curious to know, okay, is the option that I'm using actually right for me or not? And that's a question I think we all have, because there are a lot of options out there, and you hear about your friends changing and you're always like, oh, what if,
Mm-hmm. Totally.
Like when you're in a relationship, it's like, oh, but what if? And this is a good way to understand and answer that question. Is this option right for me or not? And then we support individuals if not, and, help them if it is as well.
Yeah, absolutely. And you have so many wonderful blog posts too, and articles that just tell some amazing stories and also give some incredible information. So please plug any links and social media handles as well for listeners to find you and Rhea as well.
Yeah. Before I forget, I will, plug all of our handles and things, but we are currently petitioning to secure Canadian government funding to provide transportation for folks in remote communities around Canada, primarily in Indigenous communities, to access birth control and reproductive health services that they need, along with a support person to go with them. So oftentimes in these remote communities, they don't have equal access to these services, or there might not be a medical professional in their community to insert an IUD, and maybe that's the best option for that person. Sometimes in these communities, they can't even have the resources to give birth, so they have to travel out of community on their own dime to access these services, and that just should not be the case. So our petition right now is up at change.org/mybodymyboundaries. You can also search on there just for Reya Health, and I'm sure it'll come up. But you can get in touch with us over Instagram and TikTok, which both handles are just at Reya Health. Our website is www.reyahealth.ca. And yeah, looking forward to connecting with any of you. We're always open to answering any questions.
Awesome. I love how responsive your Instagram is as well. That's how I found Rhea, and we ended up connecting. So thank you for coming on the podcast, Alice. It was so great to have this conversation, and I'm sure listeners will take so much away from it.